we have to make sure that we do all of these things before you continue wearing your hearing aids. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 256, and today I'm explaining the process that we go through over the course of our 45-day best practice fitting sequence inside of my clinic. But before I do me a huge favor, click the like button and make sure that you are subscribed to the channel with notifications turned on as well. It's greatly appreciated. So as you're aware, I've been doing a little bit of a series here explaining the process of when someone first comes into my clinic, when we recommend hearing aid technology, when we fit the technology, when we upgrade them to new hearing aid technology, and ultimately now we are on the process of completing our 45-day best practice fitting sequence. So let's just go back to the beginning here. When I first started the clinic, I decided that we needed a good amount of visits with a patient to make sure that we optimize everything with their hearing aids and to make sure that we were able to follow comprehensive audiologic best practices. Now, a lot of people I know that get fit with hearing aids, they come in, they have like a 30-minute hearing aid fitting, and then they come back for a follow-up that's pre-scheduled. And then at that follow-up, the provider asks them, like, do you feel like you're hearing better? And if the answer is yes, then it's like, great. You're a happy new owner of a new pair of hearing aids. Hand over your $6,000 to $10,000 and you'll be on your way. Call us when you need us. That is not the approach that I like, just to be clear. I feel like there's a lot of things that need to be communicated and educated over the course of a period of time, and there has to be enough time for a new hearing aid user to acclimate to their new devices, because the way that the hearing aids are programmed day one out of the gate is completely different than the way that those hearing aids will be programmed 30 to 45 days down the road. Now, just because I have a 45-day best practice fitting sequence inside of my clinic does not mean that every clinic needs to have 45 days. The human brain typically acclimates over the course of a 30-day window to new hearing aid treatment. So some people will be a little faster than that. Some people might take longer than that. But that's kind of why I like to have 45 days to do a new hearing aid fitting, because that way, or to do an onboarding fit process, like best practice fitting sequence, because at the end of that 45 days, we know that their brain is fully acclimated for the most part. You're not going to get any significant improvements in adaptation with a new pair of hearing aids after that point. And we can do a post-outcome assessment just to make sure that, yes, you're seeing significant benefit with those hearing aids. So like I mentioned, I think in last week's video, the fitting sequence that you go through, we need to make sure that we're doing all of these things to optimize your performance with your hearing aids. And once we've done that at the initial fitting, which takes 75 minutes, we have 3 additional appointments over the course of the next 45 days where you come in and spend an hour at each one of those visits to make sure that we evaluate your performance, make any adjustments we need to, and teach you new things that you would need to know to maximize your success with those hearing aids. So it basically looks like this. You come in for your fitting appointment. A week later, you come in for your 1-week follow-up. 2 weeks after that, you come in for your 3-week follow-up, and 3 weeks after that, you come in for your 6-week follow-up. Now, sometimes the amount of weeks that go in between these visits can vary. There's a lot of people in Arizona that, are traveling to different places, different times of year. Sometimes we might have to do one of those visits remotely, like through the computer, just to make sure that we're able to get someone adapted properly and to teach them a couple new things, even if they're not able to come into the clinic themselves. But for the most part, it's going to be the fitting 1-3-6 follow-up schedule. Okay, so now that we have that established, it's like, okay, great. Well, what do you do with the 1st-week follow-up? Well, the 1st-week follow-up is a lot of, okay, give me whatever feedback you had, good, bad, and ugly, all right? I need to know what things are working well. I need to know what things are not working well. It will typically identify earlier in the fitting sequence here if some of the things that you did not like were because your brain just wasn't adapted yet. And if that's the case, that's totally fine. We don't want to jump into conclusions and make adjustments that ultimately would not be in your favor long term. But that's my job to be able to identify things like that. For instance, if you get home initially after your hearing aid fitting and you're like, man, the dishwasher noise is driving me crazy, that's because your brain has not been exposed to soft level noises like the dishwasher running. But then after a week or so, when you come back into the clinic, if you're like, man, that dishwasher was driving me crazy, and I'm like, okay, it was driving you crazy day 1, but is it driving you crazy on day 7? And they're often like, well, no, it's not driving me crazy day 7. Well, in that case, we don't want to adjust a feature called expansion to get rid of soft level sounds, because you want to keep access to those soft level sounds if your brain is able to acclimate to them, okay? We want to make sure you have audibility. We don't want to take audibility away if at all possible. The other thing that they'll report is whether the volume was too high over the first week, whether it started off high and then it became too low perceptually over the course of the first week. So we want to go in and look at the data of the hearing aids to see what settings they've actually been on, to see what types of environments they've been in, to see how much they're communicating versus someone communicating with them, to see how noisy their environments were, to see how much they've been adjusting their own volume inside of the hearing aids, and then run through all of the data that we see with the patient who's sitting there with us at the end of week 1. Because oftentimes people are like, oh my gosh, you can see everything that I've been doing for this last week inside the hearing aids. And it's like, yeah, we can pretty much spy on you at this point. And yes, we do need to have FDA approval, like verbal approval from you to get permission to do that. And on top of that, we can't like track phone calls, things like that. Like we can't hear what you're saying. We just know what types of environments that you've been in typically. And once we've reviewed that with someone, then it's the time to discuss what adjustments should we be making at the first week. Oftentimes, we're making an increase in their amplification levels if we had to decrease their amplification below their full prescription at the initial hearing aid fitting, because we want to progressively get them as close as possible to their full prescription for their hearing loss to ensure optimal audibility. But sometimes people are like, they come in, we look at the data, and we see that they've been lowering their volume like 5 clicks. And it's like, oh my gosh, you've been reducing your volume a ton. They're like, yeah, things are just way too loud. And it's like, okay, well, you're probably one of the people who does not need your full prescription for you to hear your best. So what we're gonna do is we're gonna back it down a little bit, but I still want you to try to push it a little bit, where you're getting a little bit more audibility, because we have to be sure that you're able to have access to speech information and other sounds that you want to hear in your environment. But some people just do not need as much volume as other people. And then you have people come in that you fit them to their full prescription. They were fine with it day 1 at their initial hearing aid fitting, but a week later, you can see that they've been pushing their volume up a lot inside of the programming software, which tells me that, okay, you're going to be someone who needs more amplification than your full prescription for you to hear your best. So then we'll go into the software and make those adjustments for them so they're not having to constantly fiddle with their volume control either on their hearing aids or in their app. And once we get that established, then we start going into the, okay, what situations are you still having difficulty with? And then go into these subset programs, which are typically automatic, and start making adjustments to the digital features like more noise reduction, less noise reduction, impulse noise reduction, soft noise reduction, directional microphone setup, the amount of AI that you're using inside of a particular hearing aid program, wind noise reduction, feedback suppression. Like there's all these different things that have a variety of different settings that you can put in to the hearing aids in these particular subset programs to optimize things for an end user. And so here at this first appointment, like we're making usually a bunch of changes in that first appointment, because now I understand, based on looking at data and listening to them reporting to me, what types of things we want to be able to do with the hearing aids. And so once we're done with that, I basically say, okay, here's the deal. You need to go back for another 2 weeks, test out all these settings, basically live your life, and then report back to me again in 2 weeks. And so we have them come back again 2 weeks after that to report things back to me. Now, there's a couple other things that we might do in the first week that we may or may not do based on time. So if I'm having to make a lot of programming adjustments, oftentimes I will not have time to go in and teach them how to do care and maintenance on their hearing aids. I won't typically set them up for remote care services. I won't do a variety of other things in that first visit, that first follow-up visit, that I have to then kick out to the 3-week follow-up visit. But usually by the 3-week follow-up session, they're able to report back to me all the adjustments that I made. I'm able to push them up to their, hopefully, full prescription at that point, make any other little tweaks inside of the programming software, teach them, like I said, all those other things that I didn't have time to teach them in week 1. And then we don't want to leave it there. We want to have them come back in another couple of weeks, because if I make any adjustment whatsoever, I need to make sure that I find out how that adjustment worked. I can't just have blind faith that they're going to go home and everything's going to be great. So they come back for their 6 weeks. Sometimes those 6-week appointments do not take the full hour. Sometimes they take every bit of that full hour. But the point is that we want to make sure that we have everything fully optimized They're good with their full prescription, or as close as we can get them to it. We've got all the digital features set up exactly the way that we want them, and we've verified based on their reporting back to us that, or validated rather, back to us that they're actually working. And then we need to have them complete their validated outcome questionnaire. And so what that is that at the initial fitting, like I mentioned, last week, we need to make sure that we have certain things that we can use as a gauge for how much improvement they're having with their hearing aid treatment. And we need to have them rank the performance improvement from worse, no different, slightly better, better, or much better, because I like to use the COSI scale of improvement. And so at that 6 week, we expect to see them in the better and much better range, whether they're in a new pair of hearing aids or upgraded pair of hearing aids, or rather hearing aids for the first time or an upgraded pair of hearing aids after I've already been treating them. We want to see them in the better and much better categories. And if we're not, that means we may have missed something, or we are just beyond what we are capable of achieving with hearing aids at this moment in time. And only after that can we say that we've had a successful hearing aid treatment. We cannot ask them, how do you feel like you're doing? And if they say, I think I'm doing pretty good, like that's good and all, but we need to have a validated outcome questionnaire completed. That is considered best practice. And as you know, inside of my clinic, we follow best practices to a T. At that point, we are confident that, okay, everything is set up the right way, your performance is outstanding, now let's get you scheduled for your next visit that is going to be 4 months from now, which we call a gold visit, which I will explain in the next video. But let me know down in the comments section how long your fitting sequence is. I'm not talking how long the initial fitting appointment. I'm talking about the follow-up visits that you have with your hearing care professional to ensure that your hearing aids have been set up the right way and that you're getting optimal performance with them. Is it a 1 week follow-up and that's it? Do you have 6 months to go through this fitting sequence, which is way too long, by the way? But let me know down in the comment section. I'm really interested to see.